Welcome back. Today is October 1st, and that marks the start of Breast Cancer Awareness Month. Today we are joined by Kimmie Ellison, Advanced Practice Nurse at Ascension Seton Breast Care Clinic at the Cancer Care Collaborative. Yes. Kimmie, thank you so much for being here this morning.
I'm so happy to be here.
So much to talk about. You're like, I will get up any morning to talk about something that is so important to you. So
every morning I get up.
Every single morning.
And I want to talk about this.
Absolutely, absolutely. So breast cancer, we know, is something that touches a lot of families. I mean, me personally, on both sides of my family, women have been affected. What are some important things that women should know about breast cancer?
Well, unfortunately, breast cancer is not rare. 13% of women at some point in their life will receive a diagnosis of breast cancer. In the world of medicine, that is a huge number. And 85% of women who receive this diagnosis have no family history. But the good news is we have really excellent methods to screen women to catch cancer early, and that equals better outcomes, more survival.
Wow, wow. And you personally, you are a breast cancer survivor. Tell us a little bit about your story.
I am. So early on in the pandemic, around April of 2020, I was able to feel a lump in my right breast. I went and had imaging done of this, and the radiologist was able to find a mass that correlated to the lump that I felt. That mass had benign features, but just to err on the side of caution, she recommended coming back in 6 months for a close follow-up exam. I went back, just like she told me to do. We repeated the imaging. The right breast mass was stable, but there was a new finding on the left side. So I had a biopsy, and then I received a phone call several days later saying I had ductal carcinoma in situ. This is a pre-invasive form of cancer. Because it was caught early, I had several treatment options from which to choose. I chose surgery. I had surgery in December. And then about 5 months later, I had reconstructive surgery in April of 2021.
Wow, so this is recent, and you're here, a living testimony, standing here today.
I am here, and I am grateful.
Early detection, though, it's key. Talk about the importance of screenings and making sure that we as women, we're keeping up with these things so that we can detect it early.
Jayla, okay, so here's the deal. Early stage breast cancer, stage 0 and stage 1, the rates of survival for these breast cancers are 98%.
Great news.
As the stage of breast cancer goes up, rates of survival go down, which is why it is so important to catch breast cancer early. Now at Ascension Seton, we have a beautiful breast imaging center. It is a breast care center of excellence, and there we recommend women of average risk start getting annual mammograms at the age of 40. If you are thought to be at increased risk, say you have a family history of breast cancer, we may recommend you start getting your screening mammograms at a younger age, and we may even recommend supplemental imaging. And all of this is because we want to keep a close eye on your breasts to look for changes so we can catch cancer early and treat it.
Great, great. Well, thank you so much for being here with us today. Congratulations on being a survivor. I've got to give a shout out to both of my grandmas at home watching right now who are also survivors. We're going to keep talking about this all month long. And thank you again, Kimmie Ellison from Ascension Seton here with us today. We will be right back.